आइए हम सुने विज्ञान की अनकही कहानियाँ। आइए हम सुने विज्ञान की अनसुनी कहानियाँ। एक नई दुनिया की आवाज़ आपकी आवाज़, विज्ञान की आवाज़ की आवाज़।
Although the clinical demand for bioengineered blood vessels continues to rise, current options for vascular conduits remain limited. The synergistic combination of emerging advances in tissue fabrication and stem cell engineering promises new strategies for engineering autologous blood vessels that recapitulate not only the mechanical properties of native vessels but also their biological function. Dear listeners, in the previous episode, we spoke with Dr. Linda V. Thomas, Scientist F and Scientist in Charge, Sri Chitra Tirunal Institute for Medical Sciences and Technology, Trivandrum, as she shared her research in tissue engineering and regenerative technologies. Let's get along with today's episode and get more details on the ranking of India, the research contemporaries, and more as we converse with Dr. Linda Thomas. You're listening to Vigyan Ki Awaaz podcast, catalyzed and supported by the National Council for Science and Technology Communication, produced by Media for Community Foundation, content support by Kadalose FM 90.4 Community Radio, and hosted by your Surya Kiran. Ma'am, where does India stand in the global ranking of tissue engineering and regenerative technologies?
India in this area of tissue engineering, actually we have a lot of startups coming up in this segment, and the government support for tissue engineering is quite high. So we have even the government schemes like SERB, which has given us out special scheme calls for tissue engineering concepts, and there are several concept calls by DBT, ICMR, etc. So at present, even in our lab, we are having funding from several of these agencies, from DST, DBT, ICMR. Recently we got funded from ICMR for many of these tissue engineering problems that we are trying to address. So hopefully, if that is the case, India is realizing the importance of tissue engineering, and by providing such incentives or to even the startups to help them to grow, it will enable us to move forward at a much faster pace, which was not there earlier. So now, realizing the importance of this segment, government is also trying to take an initiative, and we are happy for that, because seeing it grow and come to the area, because we are now competing. Our competitors are actually globally, there are several companies which have actually started out. So there are several industries which are already upcoming, but all of them, like I said, because of the regulatory front, they are still in their clinical trials. So most of the industries globally are still trying to hit the market, and that also, it is going to be a slow phase. So if it is a slow phase globally, India has time to actually pick up on the pace, and then we will be able to come in and compete with the global front. So I'm sure we will be able to do that in the coming future with all the government support as well.
Can you tell us who are all our competitions or contemporaries in this field of research?
So basically, US, Europe already have regulatory guidelines which are set for tissue engineering problems, and for each of these phases, it ends with a clinical translation, and to move towards clinical translation, the ethical approvals and the regulations should be made easier. All said and done, we have our own regulatory front, which even though it is considered a drug, we can move into our clinical trials. But however, we have to make it more faster, at a faster pace, because any technology that needs to hit the market, it needs a lot of validation studies that need to be done before it hits the market, and clinical validation study is one of the major requirements in this area, and this is where we need to address, and hopefully we will be able to move towards this segment in near future, because we already have a clinical validation study project which has been approved by DBT in this area, so in the area of tissue engineering of cartilage.
You're listening to Vigyan Ki Awaaz podcast, catalyzed and supported by the National Council for Science and Technology Communication, produced by Media for Community Foundation, content support by Kadalosai FM 90.4 Community Radio, and hosted by your Surya Kiran. Now, can you tell us how Indian industries are associating with this project?
So presently in the area of tissue engineering, we have got a lot of interest from many industries, and the main area, so this is like when we support an industry towards developing this technology, it means hand-holding them up to the commercialization. And there is where even from starting from the validation of the product or the construct, moving it to preclinical efficacy studies, then moving it towards clinical translation, we have to handhold the industry. And this is where, the scientist along with the industry has to work hand in hand to develop this technology. It is otherwise, from the industrial front alone, they will not be able to address many of the issues as far as like how we look at it. So it's always good that we collaborate with the industries, and I'm happy to see many startup industries, especially in the area of bioprinting, that are coming up, that are quite interested in using this as a tool to reach the masses, to treat or to regenerate tissues or organs. So
interesting. Can we have a rundown on your patents, research papers, and the awards you have won?
So like I said, this technology, the tissue engineering technology, is a long-term project. It takes several years for us to establish or develop a technology based on tissue engineering. But along the way, because we develop novel biomaterials, we develop certain technologies that can help the cells to grow in these biomaterials, like the bioreactors. So development of bioreactors, so these are spin-offs which come out from these technologies. And some of the technologies that we have developed in our lab, for example, we have developed an advanced wound care dressing, which is known as lint-free absorbent dressing, which has already been transferred to an industry. So this was basically on the technology of developing the polymeric device, or so using our specific polymer. So I'm basically a MTech in polymer technology. So using these concepts, we were able to develop this foam-based technology, wherein this has been patented. Our Indian patent has already been granted. We are also waiting for the international patent. So we have filed the international patent. So this technology has already been transferred. And during the COVID times, we were also able to co-develop a swab during the, COVID, because of the shortage of these swabs. So we had an industry who was interested, who came to us, but they didn't know how to develop the swab technology. So we just helped them, giving the process of how to you can develop. They were ready to come in with the raw materials. So we just developed the process for them. And it was, during the time when the swabs were at a big shortage, I was happy to see that many of these swabs actually helped millions. So they were actually able to sell these swabs quite a bit during that time of COVID. So that is 2 technologies. And apart from this, I do have 6 patents which have been filed basically on the developmental research that we do in this segment, and several international publications as well. So in basically, because I have been an alumni of this institute, I have also initially, I started out with winning the Young Scientist Award by the Government of Kerala in 2011. I moved to US by procuring the prestigious Fulbright Fellowship in 2013. And after coming back, I have also, during my time in US, I also won the Biomedical Engineering Lifetime Award. And coming to India, so recently, I think in 2022, I also received the Excellence Award. So
thank you, Dr. Linda V. Thomas, for spending your time with us and sharing your research story so patiently. Conclusively, would you like to say anything on the Vigyan Ki Awaaz podcast as one of the STEM popularization initiative by the Department of Science and Technology, the Government of India?
Tissue engineering is a segment which is quite new, and the government is doing a very good job in actually initiating certain specific calls, and also developing or starting up several workshops as well as initiatives which try to spread the awareness about tissue engineering. And basically I'm happy to see that many of the institutes in India are actually interested and are also putting tissue engineering as a subject in their modules. So that is something which is quite encouraging, because tissue engineering actually requires a lot of disciplines working in together. So, and several disciplines, by integrating them together with tissue engineering, it makes it much stronger, because several answers need to be sought in this area in order to develop an optimum or a good technology, a tissue engineered product. And for this, several segments need to work in together. So I'm happy to see that several institutes, having branches in mechanical engineering, biomedical engineering, so they all have an aspect towards tissue engineering. Even bioinformatics now is being connected to tissue engineering. You have artificial intelligence connected to tissue engineering. So these segments are being promoted, and in future, because students who have passion in doing interdisciplinary research, this is an area which they can tap, because all said and done, it's not applying your knowledge. As a scientist, you are always learning new things. And if you have that passion to learn new things, I think tissue engineering is one area which everyone can, irrespective of whatever discipline you're in, you can contribute to this area. So this is the aspect. I'm happy and I'm thankful actually to Department of Science and Technology for funding us, as well as for the opportunity that they have given us to portray our science, and hoping that this technology can, or this area of research can attract many more people to our campus, and we would be happy to interact and collaborate with many others towards developing tissue engineering aspects or technologies. Thank you.
This is Vigyan Ki Awaaz podcast, catalyzed and supported by the National Council for Science and Technology Communication, produced by Media for Community Foundation, content support by Kadalose FM 90.4 Community Radio, and hosted by your Surya Kiran. We will meet again in another exciting episode. Thank you for listening.
आइए हम सुने विज्ञान की अनकही कहानियाँ। आइए हम सुने विज्ञान की अनसुनी कहानियाँ। एक नई दुनिया की आवाज़ आपकी
Vigyan Ki Awaaz podcast is a STEM popularization initiative catalyzed and supported by the National Council for Science and Technology Communication, produced by Media for Community Foundation, content support by Kadalose FM 90.4 Community Radio, and hosted by your Surya Kiran. The Department of Science and Technology under the Ministry of Science and Technology acts as the nodal department for organizing, coordinating and promoting S&T activities in the country. One of the major activities of DST has been to support grants in aid to scientific research institutions, scientific associations, and bodies and fellowships to students and research scholars towards promoting research and innovation activities in the country. This is being fulfilled through the implementation of wide range of schemes or programs covering human and institutional captaincy building, research and development, technology development, innovation and entrepreneurship, science and society linkage, etc. Now, let's meet the scientist of the episode who works in the development of polymeric composites for dental and orthopedic applications. Dr. P.P. Lizymol, Scientist G, Sri Chitra Tirunal Institute for Medical Sciences and Technology, Thiruvananthapuram.
I am DrLizymol PP. I am basically a polymer chemist. Completed my PhD in polymer chemistry from Mahatma Gandhi University, and I joined here in 1994. That is almost about 30 years I am going to complete. And mainly I am working on polymer based materials, polymeric composites for dental and orthopedic applications. Also we are working on other materials like caries removing agent, that is dental caries removal agent, then polymer based bioactive bond cements, then intrauterine device, and many more products. And ours is one of the oldest division in this biomedical technology wing. From our division only this famous blood bag marketed. So this is basically all polymer based materials. Biocomposites also we are working, that is soy based proteins for periodontal guided tissue regeneration, and these are my main areas of work. Then also I am working on science popularization, that is writing articles and books. And recently one of my book published in Malayalam, that is local language, got the Kerala State Science Literature Award, that is from KSCST. That is generally for popularization of science among school kids. That is my... And also we are doing innovative research, that is developing new polymers, and for which we got 2 national innovative awards, that is National Award for Technology Innovation, that is 7th and 10th awards we got. And our IUD also got the 1 national award. That is a collaborative project with Hindustan Life, that is HLL. It's a joint project, and for that we got the national award. That product is also marketed under the trade name. It is a substitute for Marina, that is commercially available product, and it is marketed with the name Emily. It is marketed with the name Emily. This we know. Tooth, it is a non-vital material, and when a permanent our tooth damaged, it cannot be restored normally. So we have to replace part of the damaged tooth with the artificial materials. For that we have to develop some materials, and at present materials, almost all the materials are importing except amalgam. Still our dentists are using amalgam, which is aesthetically poor and has toxic problems. And the concern is that these imported materials are of high cost, and their storage in our climatic condition is difficult. That is, many times the material may get damaged and the patient is not getting good treatment at affordable rate. And also these dental problems are a common problem that we can see. These dental problems are the most common, or is compared to our common cold. So it is almost about 90% of the population have one or other dental issues. So we have to do something to solve these dental issues. And this dental disease, if we are not treating properly, it can lead to complex situations, because this bacteria, the same bacteria is causing atherosclerosis and other issues. So we have to solve all the dental issues at the mouth itself. That is why we are concentrating on developing new dental materials with the purpose that our common people get good dental treatment at affordable rate.
The need for women's empowerment and the promotion of gender equality is particularly crucial in the fields of science, technology, and engineering. Historically, women have been significantly underrepresented in these fields due to various factors, including societal stereotypes and bias. Encouraging and supporting women's participation in these fields is essential for scientific advancement and innovation. By empowering women and promoting gender equality, a more inclusive, diverse, and strengthened scientific ecosystem can be developed. The Department of Science and Technology, that is DST, is implementing a dedicated scheme, Women in Science and Engineering, that is Kiran, Wise Kiran, to cater women of all walks of life in order to enhance their participation in the field of science and technology, that is S&T, with ultimate goal to bring gender parity. The Wise Kiran scheme is a holistic approach to address various challenges faced by women in their scientific journey through different kinds of programs. Moving on, let's listen to Dr. DrLizymol as she shares her areas of research. Now, let's get to know the potential benefits of this research for a common man or nation's field of science as whole, as shared by Dr. DrLizymol.
So we can see 30 to 35% of the total market medical devices from dental, and so the cost is very high. So since we are importing all the dental materials, patient has to give higher payment, and also whenever the material get damaged, the clinician will use the same material because they are purchasing with a higher cost, and they will use in such a way that material may fall even after a few months. We are intended, or the material is intended to keep in the oral cavity lifelong. But the in between, if the material falls, or then it will become very complicated situation. That is, the patient has to again go to the clinician, then again do the restoration. That is, the process has to repeat. That is causing much loss of money, work hours, and we know tooth pain is one of the most severe pain. So the patient is getting lot of complications and aesthetic problem also. Another thing, because of this high cost, many of the common people are not going to the dentist. They will try to solve the problem or solve the pain from the over-counter medicine, getting over-counter medicine, or even taking antibiotics. And it is causing, or simple pain, they will go and take antibiotics, and it can many consequences. But if a person can get an affordable treatment in a very easy way, without side effects, without aesthetic, because when we are using amalgam, we can see it is aesthetically poor. So if a common man can get good treatment at an affordable rate, then automatically person will come. So that is the benefits to the common man, even pediatric. So even the kids, they have caries. Caries is one of the main problem. That is an infectious disease. If that caries cannot be treated, then it can become gingivitis, then periodontitis, then it will contribute to delayed diabetics. All these issues come. Lot of studies reported that this when the kids have this gingivitis or periodontal disease, the chance of getting diabetics in the middle age is very high. So it is very important to treat and prevent dental diseases. So if the patient or the common people are getting good treatment at affordable rate, then it is actually life-saving and helping them to have a good and healthy life.
Sri Chitra Tirunal Institute for Medical Sciences and Technology, that is SCTIMST, is an institution of national importance under the Department of Science and Technology, Government of India. The joint culture of medicine and technology, pioneered by its founders and more than 3 decades ago, has come of age and gained unprecedented acceptance in India. The institute has the status of a university and offers excellent research and training facilities. It has 3 wings: a tertiary referral super specialty hospital, a biomedical technology wing, and the Achyuta Menon Center for Health Science Studies. The institute focuses on high-quality, advanced treatment of cardiac and neurological disorders, indigenous development of technologies for biomedical devices and materials, and public health trainings and research. The institute offers advanced treatment using modern technologies in several specialized areas such as interventional radiology, cardiac electrophysiology, deep brain stimulation for movement disorders, epilepsy surgery, pediatric cardiac surgery, based off skull and vascular surgeries, to name a few. The institute has excellent facilities and teams of professionals dedicated to the development of innovative biomedical devices and products, evaluation of medical devices to global specifications, training in novel specialties, and research in medical and public health areas of social relevance. Dear listeners, We will catch up with Dr. DrLizymol in the next episode as we discuss on the research contemporaries, Association of Indian Industries with these researches and more. Until then, take care. This is Vigyan Ki Awaaz podcast, a STEM popularization initiative catalyzed and supported by the National Council for Science and Technology Communication, produced by Media for Community Foundation, content support by Kadalose FM 90.4 Community Radio, and hosted by your Surya Kiran. Stay tuned.